Hey, Alan, how are you? It's so nice.
I'm good, Abe. How are you today?
Thank you for taking a Sunday out to come and talk.
Thank you for welcoming me.
Well, I can't welcome you because this bill is a product of all our collaborative efforts. So it's as much yours as it is to all our members.
Yeah.
So, without further ado, Alan, tell me, why is this bill, well, no longer a bill? Why is this law so important to you?
Well, it's important to me because I've personally experienced a substance use disorder that impacted my entire life. And I had the good fortune of being given help through a program where I could get remediated, I could get rehabilitated from my problem without uh, negatively impacting my license, my career, my reputation, my family, so on and so forth. Um, so I was offered what's called an alternative to discipline by the licensing board, um, and the the program that existed when I needed help went away, and I've been working to get a program like that reinstated, what's known as a diversion program, where the board says to somebody, "Look, you can be disciplined, or you can go get the help that you actually need, and we'll protect your license. We'll do this confidentially." And so, a person can either maintain or get back to their license and their practice and to serving the public um, safely and become a better provider because of it as well. So I've been working, this law was about getting us back to a point where that was available to our members, to my colleagues, uh, through a diversion program.
So, Alan, I remember it was many, many years, maybe 6, 7 years ago when you approached me and Representative Chan. And I think at that time, the program that you had benefited from had no longer existed.
Right.
And I don't know if you're privy to this, but so during this lapse where this program was no longer available, what would happen to one of our colleagues? Now, when I say colleagues, I mean dentists and hygienists. Well, that covers in this law, that is covered by this law. What would happen to them in the case that there's a mental health or a substance abuse related complaint? So without a diversion program, what happens to these to members of our community?
It's a great question. To know that, you have to have a communication with the board that really holds the keys and makes those determinations. Um, and the board has not been forthcoming over the past decade about how they were handling cases. But the board was in a position to uh, discipline the licensee. That could include publishing their information on a public-facing website, reporting that person to the National Practitioner Data Bank, restricting their practice. Okay, which, as we've talked about, can impact not only that dentist but the staff that relies on that dentist for their income, and of course the community that the practice serves. Um,
So, I mean, I know the answer, but I want to hear it from you. And that
mhm.
is, when that happens to a dentist, what happens to the rest of his or her career? Or a hygienist, what happens to their career?
You know who talks about this very openly is Brett Kessler, who's the president, as you know, president of the ADA right now, and he has a similar type of history, and he will tell you that even now he's as president of the American Dental Association, he is still required to report his history to his board even today. So it's a mark on his license, a ding on his license that stays with him. So that's what happens, and it can undermine a person's practice and livelihood.
So when Taki and I, wrote this, we kept in mind not only the dentists, but our hygiene colleagues, because they are integral part to the oral healthcare team.
Hmm.
Do you have any input about that component, including our hygiene colleagues?
Yeah, so this is new. There's never been a program for hygienists before. There are comparable programs in many states around the country, if not all, if not all. Most states have some sort of a program like this, and many of them will do work with hygienists, even assistants and other team members. But being able to include the hygienists is going to help. It's going to bring a lot more people into the fold and get the message out more and help more people.
So, Alan, this is a no-nonsense bill, but the reality is it took Representative Chan and I a very, very, very long time to push this through.
Mhm.
It was not easy at all. I mean, and without the help of many of our colleagues at MDS, our Government Affairs Committee, people from the Alliance of Independent Dentists, heroes such as your good friend and my good friend, Dr. Jeff Lowenstein.
Mhm.
If it wasn't for all these people, we would not be able to push this bill, this no-nonsense bill through.
Yeah. So when I first started this process of trying to get a bill passed, someone said to me, just having a good idea doesn't mean doesn't mean something's going to happen, and that was indeed the case. Right? I mean, I was going to the State House year after year after year trying to get this in, and it truly was. I want the audience to know that it wasn't until your presidency where we were able to push this through.
But Alan, I have to be honest, year after year, I remember last year, I promised you that we would get this through. And,
Hmm.
and I remember, having to send you that text because I couldn't call you and said, I'm really sorry, Alan, couldn't get this thing through. So Alan, you're a hero. You really are.
Hmm.
Me and Taki, we could write bill, we can push legislation, but it really takes a hero and years of dedication and guts to tell your story in order to create change. Uh, our profession, we're extremely grateful to you for the work that you have done. Now that it's law, it's law. Can you believe it? I'm so proud to say that what we've written, what we've worked together, has become law.
Yeah.
What
It,
can we
it's
do?
it's hard to believe.
It's so hard to believe. What can we do to help our colleagues? What can we do to get that message out? How can anyone listening to this video perpetuate this success to protect our profession, the hygienist and the dentist? What can they do?
Well, I suppose they can work through their representatives to encourage the board. Now that the board is required to uh, utilize a diversion program, uh, they can let it be known that this is something that the public that they really want. And as representatives and legislators need to hear from us and need to hear from their constituents just how important a bill like this is. So the more people whose voices are added, gives us a better chance that the board will act on this expeditiously as well.
So, Alan, before we close, just from a practical aspect, tell me, I wrote we wrote the law, but tell me the process. So let's say we have a dentist or a hygienist, and he or she suffering from a substance abuse or a mental health disorder, and they want help. Explain to me the process. What happens?
Yeah. Well, first of all, it's a very difficult thing for someone to reach out for help like this. We create, we try to create these wonderful resources, and we try to get the word out that everything we do is confidential. But nonetheless, it's 1,000-pound phone to pick up when you have to reach out and say, I'm human and I've got this issue and I can't seem to manage it on my own. So right now, there are actually a couple of organizations that are available to Massachusetts dentists and hygienists who have a substance use or a mental health issue, where they can make a phone call or send, and get in touch and get some help. The first one is what's known as Dentists Concerned for Dentists. That is an independent 501, I always say it wrong, 501c3 nonprofit organization endorsed by the Massachusetts Dental Society and funded by the Dental Society. This organization has been around since the 80s, and it is the first point of contact for a dental professional in Massachusetts who's ready to either get some information or reach out for help for themselves or for someone else. And frankly, anybody can call Dentists Concerned for Dentists. And from there, you've got a dentist who has some lived experience, who can provide, first of all, a compassionate ear, and share through life experience, share what might be some good starting points, some resources, and try to get a sense, we try to get a sense at Dentists Concerned for Dentists as to what's the situation here. Is this something that someone just needs to talk a little bit, or they just want some information, or should they be referred to some professional for an evaluation? And so we kind of know where to start, sort of case management services, if you will. But also, as a dentist, I care very much about anybody who's going to call. And I think it's comforting to be able to talk to someone who's been in your shoes. Dentists Concerned for Dentists deals strictly with substance use issues. It's this new diversion program that we were talking about, that the state has just launched. They essentially are set up to handle referrals from the board. So whereas Dentists Concerned for Dentists is likely to get calls more from people who have not reached the board's attention, if you will, no patient complaint, no harm, no arrests or anything like that. Dentists Concerned for Dentists is the obvious first choice. It's not involved with the state per se. It's completely independent of the board of registration and everything else. And not even anyone at the Massachusetts Dental Society other than us knows who we talk to. So it's very confidential. But the new diversion program, which has the acronym URAMP for Unified Recovery and Monitoring Program, is the diversion program for the state now. So if a dentist contacts URAMP, they have an opportunity to get rehabilitation for not just substance use issues, but also other mental health conditions. This can include, the program is very new. It's just launching, but burnout, anxiety, depression, but generally potentially or actually impairing conditions, and that's why they would have gotten onto the board's radar. And beyond that, the Dental Society has a Dentist Health and Wellness Committee, which is doing tremendous work to not only to get the word out about those resources I just mentioned, but to offer advice, tips on self-care, essentially. And that's so important because a lot of the people who end up having bigger problems down the road might not have gone that far if they'd gotten some help before their problems were anywhere near the level of impairing practice. Does that make sense?
That makes total sense. And I want to thank you. I know you've been the consultant for our Health and Wellness Committee, and Dr. Lowenstein and you have visited pretty much every single district prior to this, while this was a bill.
Anyone will have us.
We're grateful to that. But I just want to hone in on this important point. So say we have a colleague and he's developed a opioid abuse situation, and this is important, and a complaint has been filed against this colleague of ours. Walk me through the steps. So URAMP steps in, right?
Well, actually,
Go ahead.
not necessarily. So if you're asking what actually happens, at some point, this person would likely, if there's a complaint, they'll be called before the board to explain the situation. It usually doesn't happen very quickly. There can be months gone by between when an event takes place and when someone actually has to go before the board. They may get notification from the board right away, but they may not actually go to the board for some time. So there are situations I've dealt with in the past where someone calls dentist concerned for dentists. We can immediately start them on their recovery path by connecting them with support services, support groups, medical evaluation, what level, what's the seriousness of this issue, get people and get them started actually on a monitoring program so that by the time they go before the board, they can say, look, yes, this happened. Here's what I'm doing to keep myself a safe provider and to avoid harming the public. This is what I'm doing. This is how I'm being held accountable by, dentists concerned for dentists. So, that's why we always want to encourage people to get in touch with us early, as soon as possible, if they're concerned they might hear from the board or there has been a complaint, because it's always only a matter of time before the board gets around to them, and the sooner they start becoming accountable, the better it will go.
So, there's this aspect that we placed in the law, and that is that any, for after, during this recovery period, if somebody's in the program, this information cannot be subpoenaed. This is kept confidential. And there's a component where after 3 years, the files gets completely destroyed. Could you speak to that?
Yeah. So that, you basically, you summed it up pretty well. If entering a remediation program, whether it's through Dentists Concerned for Dentists or through URAMP, is always a voluntary decision by the licensee. Of course, there's pressure to do something. You're basically being given a choice, discipline or rehabilitation. And so one would voluntarily choose to get the help that they need,
Alan, just to close, I know you're an expert at this. How many states have a robust program as this law that we've recently written? How many states have that? And are you aware of any of our neighboring states that do not have a diversion program such as the one that we've just put together?
So this is actually something I spend a lot of time on. That little green and white sign back there is for the National Council of Dentist Health Programs, which some of my counterparts around the country and I started a few years ago. And we're in the process of learning what the landscape is in all 50 states. Things vary tremendously. There are some states that do not really, some dental society / associations that don't really or haven't yet invested in a health and wellness component. So that's, what dental societies do across the country varies greatly in terms of health and wellness. And then the legislation, as you know very well, varies tremendously from state to state. So there are states where there's legislation in place that says that there will be a diversion program and that we're going to offer this confidential pathway for people to get better. I would say that almost every state has some sort of a program, but the devil's in the details. Some are more confidential than others. Here in Massachusetts, we're lucky. We've dotted the I's and crossed the T's. It's perfectly confidential. To get back to your previous point, yes, someone who enters this monitoring program through Dentist Concern for Dentists or URAMP or wherever, um, the records are not subpoenaable. They're protected by law, peer review law. And if a person completes the program successfully, as you were saying earlier, the records are expunged, I think is the right word. Gone, literally. So, yeah, I think I'm jumping a little. I'm not sure if I
No,
answered.
that's okay. I'm just wondering, are you aware, say, our name, New Hampshire, Connecticut, Vermont, Maine? I'm really thinking about our first district. Do they have similar laws? And if they don't, what can we do to help them so that they can establish a robust law as we now have here in Massachusetts?
Um, well, first we can get ours finished. We can get that law. What's the word that you use?
Get the regulations.
The board has to set rules and regulations that are applicable for the new law, right? So we want to help the board get to the finish line on that, and then we'll have a model that we could share with other states. There are, I believe, 4 states where the diversion program is completely within the dental community. There are 28 or so states where if someone is referred to a diversion program by their dental board, that program is actually outside of the dental community in the physician health world, what's known as a PHP, a physician health program. So it's hard to talk about, what it looks like because it varies so much. But again, this council that we started is very much in the process of cataloging all the data on what is the dental society doing for health and wellness? What does the legislation say? What are the rules and regulations of the licensing board? And then what we can do, take examples like Massachusetts and other states and say, here's how we think you can, go to a dental society and say, this is what we're trying to set up. This is what we can help you get set up on. These are some ways that you can provide more for your members.
Alan, I'm an immigrant, and I can tell you there are many, many communities where it really literally took a village to get a dentist back into that community. The cost of education for a dentist, the cost of even undergraduate education is exorbitant. And I never thought it made any sense for us to punish colleagues and not give them a way out. Because it doesn't just harm the dentist, it harms the entire community when we don't rehabilitate and punish. Thank you for the work that you have done. I remember years and years when we first met. And of course, I want to take this opportunity to thank Representative Chan. He's been such a strong advocate for our profession. Had it not been for him, I could write any law I want, any bill, but had it not been for him and you and our entire army, had it not been them, I could write anything I want and there would be no chance. And I also want to thank Speaker Ron Mariano of Massachusetts. He's really been a champion for healthcare, for not just our profession, for access to care. So with that said, I think we should conclude. Do you have any parting words?
I will just say that I was the last person in the world who would have gotten involved in anything that smacked of politics. So if I can do it, other people can do it too. If you believe passionately in something, you got to fight for it.
Thank you, Alan. And I hope this helps our colleagues and improves access to care.
Yeah, thanks for helping get the message out.
Thank you.